I think in the future, learning will be more open and more accessible and more varied, so that more people are able to learn in different ways and for different purposes across the lifespan, so that learning will be life-wide and lifelong. We might argue that learning has always been available, but often it was available in fairly narrow forms and to perhaps only a small section of the population worldwide. Learning will be more accessible, more open and more available freely to everyone at any time and for any reason.
There will be big changes in learning that will come down the line, and some of that is around the structures that we have in terms of a degree, looking at micro-credentials, just-in-time training, and the way that education is getting, I suppose, packaged into smaller kind of samples.
The future of learning is online and digital, because we need to follow and adapt to and be proactive with the UNESCO and United Nations development goals, especially in education, number 4, but also that the SDG 4 have influences and impact on all the other SDGs. And the only way forward is online to reach the education for all.
So the future of learning is likely to be much more flexible, more blended, more hybrid across the continuum of formal and informal learning. I think in terms of the process and who is involved in the learning process, I think we're going to see many more stakeholders involved. So it will be in higher education, academics working with learning designers and other stakeholders to make learning more engaging, and especially as it goes more online.
Outside of higher education and of other formal education, we're going to see online learning and online pedagogies coming into play within industry. Again, we can see that with some of the big industry players like IBM, Amazon. They're investing in education for their staff and their employees, and I think we're going to see more organizations utilizing online learning. The current model is often that people are spending a number of days attending workshops. That disrupts their whole work process by making certainly the theoretical elements available online that staff can do in their own time, and then perhaps coming for shorter workshops where they actually participate in activities that reinforce that theory. We're going to see those kind of changes. So it was just-in-time training for industry, and industry requirements will become a much bigger user of online education.
So away from higher education, online learning gives many more organisations such as NGOs and businesses the opportunity to upskill their employees or their target audiences. And so I think that there's potential for collaboration between universities and other organisations. So perhaps it's not so much that online learning will take away students from higher education, but that there will be opportunities for more authentic collaborations and curriculum development going forward.
Outside of the higher education context, online learning can be useful to people across their lifespan, from childhood right through to older adults post-retirement, for any purpose, whether that be employment related, upskilling, credentialing, retraining, but also for reasons that are personal and spiritual and to do with hobbies and self-actualization in the widest possible form. Online learning can cater for any learning, for any person, for any reason.
Good morning and welcome to this healthcare focused session at our Festival of Learning. My name is Helen Fuller and I'm the Global Healthcare Lead at FutureLearn. In this session, we're going to be hearing from 4 of our amazing healthcare partners who rapidly developed courses in response to the coronavirus pandemic and who've made a significant difference to a large global learner base. So just a bit of context, in the early days of the pandemic, there was an initial hunger for robust and trustworthy information, and we'll hear how the London School of Hygiene and Tropical Medicine provided just that. The need then to support professionals dealing with the challenges they were facing grew rapidly. And we'll hear about courses for those working in critical care, diagnostics, and general practice. Before we start, a small matter of housekeeping. We'll be asking your questions to the speakers directly after their talks, so please do post those in the chat. So on to our first speaker. Mary Abetto is a Research Fellow in Education for the UK Public Health Rapid Support Team, based at the London School of Hygiene and Tropical Medicine. The course COVID-19, Tackling the Novel Coronavirus, was the first on the FutureLearn platform. It was developed with a broad audience in mind, with particular attention being paid to its accessibility for those for whom English is not a first language. The course has attracted hundreds of thousands of learners. Mary, we're looking forward to hearing more about it.
Hello all. Apologies, I'm not entirely sure if you can hear me at this point. Can you hear me?
We can.
Great. Thank you very much, Helen, for that introduction. So, just as Helen said, the course developed by the London School of Hygiene and Tropical Medicine was titled COVID-19, Tackling the Novel Coronavirus. The aim of this course, the main aim of this course, was really to address the widespread of misinformation on the virus at the time. And so naturally, we felt that the target audience needed to be quite broad. And after some discussion, we thought it was appropriate to make the course accessible to just about anybody who was interested in the outbreak. And I think we can all agree that that is just about everyone. Within the school, the UK Public Health Rapid Support Team sits. It's a partnership between Public Health England and the London School of Hygiene and Tropical Medicine, with a specific mandate to supporting disease outbreaks in low and middle income countries. And so it was appropriate that this particular team, which I work for, would support the development of this course. So the course was developed quite rapidly over the space of 6 weeks. With a very focused group of individuals. That focused working group was developed based on individuals who had prior experience in developing MOOCs during outbreaks, also individuals who had public health expertise and pedagogy expertise. We initially had grand ideas of doing a survey of the partners for the UK Public Health Rapid Support Team in order to understand the needs of those partners. And we quickly realized that we just did not have the time to do that. And so we did a gap analysis largely based on our own knowledge and trusting that we had enough experience within the team to inform that. We also felt it was appropriate, given the rapidly evolving nature of the course, to not focus on specific guidelines and measures, but to instead focus on the concepts and the principles behind a lot of the public health interventions that were being introduced, and adopting a very social constructivist approach, which I can describe more in the questions if anyone wants to discuss that more. And lastly, also speaking to the large audience, we thought it was appropriate to have a multidisciplinary international group of contributors. The course ran over the space of 3 weeks, with the first week focusing on how the virus emerged and was identified. The second week looking then at examples of public health measures worldwide, and the third week being more of a look forward at the different things that we needed to inform how we manage the outbreak in the future. Naturally, as I expect with so many of the courses on FutureLearn, we used multiple formats, but that was again to speak to our large or wide audience, and wherever possible to again address this issue of the information rapidly evolving. Wherever possible, we included additional resources in the See Also sections that were being updated in real time. So the first course started on the 23rd of March, and due to the high number of enrollments that we were seeing at that time, we felt it was appropriate to have quite a large group of individuals enlisted to support the facilitation of the course discussions. Naturally, we were quite conscious and anxious actually about the volume of comments and the types of comments. We were concerned that individuals may want to use this platform as an opportunity to spread false news, and how would we manage that? So we set up something that was quite systematic in our way of reviewing every single comment and ensuring that they were all addressed in a cohesive way. Again, happy to discuss that in more detail if anyone wants to know how we went about that. We tried to be as responsive as we could to the individual comments on the course. For example, we started with 5 language translations, and during the course of the course, following feedback from the learners in the course comments, we saw that it was appropriate to add an additional 2 languages, as learners were saying, you know, there's a lot of us here who speak this other language, and I think it's appropriate to translate accordingly. And so we did that. And the first course remained open for 6 weeks following its initial 3-week run. And in those 6 weeks, we were busy updating the course in order to run an updated course. This updated course and the changes that we made were largely informed by feedback from the London School's Centre of Excellence and Learning in Learning and Teaching. We were very fortunate to have members of that centre actually taking the course as participants, so they were able to give us participant feedback. And one of the main things that they recommended was to include more guidance in the introduction sections of each step, so that learners would be guided as to what they could be thinking about and contemplating whilst they either watched or read the particular content for that step, and then repeating those questions in a pinned post to start the discussions. And we found that that worked quite well. Naturally, we were constrained by physical distancing measures, but we were able to update each step of the course either by using text updates and also remote recordings. We added steps on Europe, fragile contexts, and the wider social and economic impacts, because those are the things that were starting to really be more topical at the time of the second course. And more interestingly for me, we added an animation that spoke to how to discuss COVID-19 with children, as this was again something that those attending the first course identified as a need. So the second course ran over the course of 3 weeks again, and we saw many of the learners from the first course returning, which was quite nice. And we also saw that in the second course, the discussions were a lot more in-depth and a lot more reflective. That second course remains open at the moment and will continue to be open until the 26th of July. We're not planning an update of this particular course, and so in the second course, we particularly focused on highlighting the See Also resources that were links to sites that are updated in real time as a means for learners to continue to update themselves with reliable sources. We saw, as I mentioned earlier, some quite high uptake for this course, with over 100,000 enrollments by the start of the first course and over 200,000 enrollments from 184 countries by the end of that first course. A very significant number of comments, which was a challenge to manage, but we felt that we were able to look at every single comment using this system that we had developed with those 20 facilitators, as I mentioned. The second course then saw much reduced numbers in terms of course enrollments, but interestingly, interestingly, a different proportion of comments to learners. And it was interesting the types of comments that we were sort of seeing coming through in the second course. Other uptake of the course has been that the course has been incorporated into the pre-deployment training for the African Health Volunteers Corps, and this is a team of people that is used by Africa CDC to assist in their response to COVID-19. And we've also heard that the course has been incorporated into a number of medical school curricula. kind of outcomes that we've seen is quite a high uptake in terms of numbers and a spread globally. And with those who have completed the course feedback for the first course, it's about 50,000 people completing the course feedback, very high and rates of acceptance of the course, with most reporting that they found the course exceeded their expectations, they gained new knowledge, and that they shared that knowledge with others, which is what we hoped. More broadly, we've also seen the course picked up by a number of media outlets and is also recommended now by Health Education England as one of its recommended courses for healthcare practitioners, mentioned in the Gov UK website as a course that's recommended for employers and employees. And we've also recently published a letter, an open letter in the Wellcome Trust, describing the process that we undertook. We're currently having a closer look now at the role of MOOCs in outbreaks, wanting to specifically answer the question of, can MOOCs be used as an additional tool to more commonly used methods of communication and engagement during outbreaks. The thinking behind that is really that these more commonly used methods, such as public health announcements, posters, and so on, adopt very behavioralistic approaches, which infer quite superficial learning, whereas MOOCs have the potential, particularly if adopting constructivist approaches, to infer deeper learning and subsequent behavior change. Thank you very much.
Thank you, Mary. That's given us a really fascinating insight into the many considerations that you had to make in terms of developing the course and also running it. We've got time for one very quick question. You mentioned at the beginning that there was a need for trustworthy information to be out there in the public domain. To what extent do you feel you achieved that objective?
One of the things that we are currently doing is this in-depth analysis of the MOOC. So I feel that once we've kind of completed that analysis, I'll be able to kind of give a more precise answer to that question. But just in a very anecdotal level, you know, with the course comments, we were able to say, when someone asked the question, we were able to say, please see this particular see also resource, which provides you with more information on the theory behind, say, the use of face masks, or what the current WHO guidelines are on a particular thing, or what your own nation's guidelines are on a particular thing. So really, we did wherever we could provide resources for people to be able to access those reliable sources of information themselves, both during the course and ongoing. So that's what I can say from an anecdotal perspective at the moment. The extent to which that was done, I feel like we need more investigation to be able to answer adequately.
And certainly from a FutureLearn perspective, the uptake for the course, you know, indicated a massive need that you met extremely well. So there's just one quick question from David Moon, who says, Mary, could you please explain what social constructivist principles means?
Great, I thought this might happen. I'll do my best. I'll do my best. Essentially, it's an educational theory. It's based on social constructivist educational theory, which essentially says that you can provide a particular learner with the skills with which to develop their own knowledge. So it moves somewhat away from more traditional theories, which are more behavioralist, where you sort of say, this is what it is that you need to learn, repeat it, and the assessment is very much based on recollection of what it is that you've been taught. This instead sort of says, okay, these are the concepts, these are the things that we know so far. Based on that and your own experience, what is it that you interpret from that, and allows you to kind of build your own interpretation of a particular situation or, you know, topic that's being discussed. I hope that does that justice.
It does, and certainly it's something at FutureLearn that we talk about in our social learning So thank you, yes, for explaining that and for your really fascinating talk. Mary, thanks very much.
You're very welcome.
I'm delighted now to introduce a double act from the University of Edinburgh. Graham Nimmo is a consultant physician in intensive care medicine and clinical education, where he's currently the programme director for the Critical Care Online Masters. One of the posts Graham's held in the past is as the president of the Scottish Intensive Care Society, so we're in esteemed company. Graham's co-presenter is John Jack. John is a hugely experienced learning technologist and designer, and has experience of working in Canada, New Zealand, and most recently Norway. He's an avid lifelong learner and is currently on the Digital Education Masters programme at Edinburgh. Their incredible resource, COVID-19 Critical Care, Understanding and Application, broke the FutureLearn rulebook with the speed that it was developed. So, Graham and John, over to you.
Thank you very much, Helen. It's a real pleasure to be here. I'd like to thank the organisers for inviting us, and Dominic and the production team for your support. John and I are presenting this on behalf of the programme team that we put together for this FutureLearn course. What we've experienced over this time, particularly from FutureLearn, is willingness, generosity, and putting that into action. And I'd highlight Christine Melledoux and Beatrix Daniel in FutureLearn for their help. We run this MSc in critical care. It only started in September last year, so we've been developing it for the last couple of years, and we have a lot of online resources which we develop for that. This timeline is very aware of it in terms of what's happened with the virus and with lockdown. We went to the principal of the university and said we'd like to suspend our MSc because our learners and our faculty are all frontline clinicians and would be dealing with the frontline patients in COVID, and that we got immediate support for that. So within a few days we had shut down our MSc, and then we thought, with some of us, what could we do to help? So we did a rapid needs analysis through NHS Lothian and NHS Education for Scotland, and an expert gap analysis has already been described by Mary to work out what the issues were. And we came up with 5 themes. So it's interesting that we have themes rather than weeks, and although our MSc is based on 6-week courses, this was a learning platform and materials which we felt people could come to 1 or maybe 2 of these and not have to work through them in a week-by-week process. So the deteriorating patient for anyone, and this is in-hospital-based acute care, the daily practice of critical care for people coming back to critical care who hadn't worked there for a while or had never worked there before, and also for individuals in the hospital setting who were moving up in the terms of the level of sickness of the patients they were looking after. We have a COVID specifics area about critical care for the COVID patient, and then the bread and butter of intensive care organ support. We were very keen right from the start that there was stuff in there about self-care and staff well-being. We have a particular interest in caring human factors in our MSc. I'm going to hand over to John to talk you through the timeline.
Okay, thanks, Graham. Hi, everyone. Can't see my slides. Can we share Graham's slides still? Okay, perfect. Yeah, so, okay, going to cast your mind back to 6 days in March. And I guess in these kind of strange times, it feels like a lifetime ago in a way. So on Tuesday, the 31st of March, we had our initial kickoff meeting with FutureLearn. Helen, I think you were in that one. I think that was my first involvement with this piece of work at that point as well. So we had the initial kickoff meeting. Went quite well. There were some sticking points around discussion boards, which for the similar reasons that Mary highlighted in her initial talk. And there were some sticking points on the week's format. We saw this as not a sequential asset, more that people could kind of dip in and out of. So not having to follow it week by week. But generally it went well, and then we kind of agreed to proceed. So then the Wednesday, the 1st, and Thursday, the 2nd. So I'm going to gloss over a furious amount of work and a ridiculous amount of emails that were flying in all directions. We worked, a lot of work happening on those 2 days. By Friday, actually, we were meeting daily as well to kind of check on progress. By Friday, we had another meeting. And we all agreed we were making good progress, aiming for a midweek launch. Then we had a discussion with FutureLearn, and we kind of found out that all courses have to launch on a Monday. And we totally believe that if they could have launched it for us on the Monday, they would have. The discussions issues was resolved, and again, to FutureLearn's credit, because we all know the system, and the conversation with the learner, and the whole system is built around discursive practice in a way. So we agreed that the discussions would go live, and Graham had we had a solution for who was going to be managing the discussion forums. So we made the decision as a team that we would launch for the following Monday. We thought at this point in time that a week was too long to wait. So that was Friday. Saturday, 4th of April, the landing page went live. We've done MOOCs with FutureLearn before, so it's normally 6 weeks prior to the course going live, I think. We then started our own internal comms, because up to that point we had nothing to comms to. We didn't have a landing page. Beatrix sent me the 30-day QA review document at 10:30 on Saturday night. I had a mild panic, then emailed around everyone who kind of quickly calmed me down, like, let's just work through it sequentially and logically. Sunday, 5th of April, so they're still working through the QA. A lot of the issues were subtitles, a lot of kind of medical text, which meant that the learning designers and learning technologists were unable to interpret. So we had the clinicians a quick intro and training on 3Play, so they were able to get in and start transcribing and subtitling the content. We were still building content at this point because everything was still changing. What advice was good on Tuesday, we're finding that was causing harm by Sunday. So there's new content being built. The course went live at 1 a.m. on Monday morning. I was still up. Graham, I think you were up. I don't know what I expected to happen at 1 a.m., but I was there just to see the doors open. So if you go on to the next slide. Okay, so this is just looking at some of the numbers for the first 2 weeks of the launch. So we've got Friday, the 3rd of April. So we had 0 because there was nothing there. Saturday, the landing page went live. We had 543 people sign up. Sunday, 2,500. Launch day on the Monday, we were up to 5,000 learners with 80-90% from UK. I think our own institutional marketing kicked in on the Monday or the Tuesday. That took us to 10,000. The Wednesday, Graham was on BBC News, so reporting Scotland at 6 o'clock and at 9 o'clock. And again, we just saw our numbers going up and up. And I guess at this point in time, we're seeing a lot of these exponential graphs, and I think we all agreed that this was one graph that we kind of wanted to see in this shape. So then by the 15th of April, we had 27,000 learners enrolled from 183 countries, 400,000 steps visited, and just over 6,500 comments posted. And I guess for the comments, we were thinking of something that we were initially going to suppress, and it kind of became integral to the course. And I think okay. So the good stuff. I did, when I was creating this presentation, I did have a bad stuff slide, but it sat empty for almost the whole time. So the good stuff, I guess, and the things that worked that made it possible in this short time were the daily progress meetings with the clinical team. Graham and I had worked together before, and some of the others in the team would we'd cross paths and work together, and it made it much easier to be able to ask for things really quickly. What else helped us? Office 365 and Teams. We quickly realized the kind of the limits of email. You know, there was hundreds flying around and they were getting lost. So we all started working on one shared document, and we were just crossing off the tasks as we finished them. What else was good? Obviously, I'm not giving this talk to FutureLearn, but I've always been a big fan of FutureLearn, and more so after this project, your willingness to adapt the system, just to work round the clock, and yeah, I guess just to help and be with us as a team. It was really, really impressive. And again, willingness across our institution, across my division in LTW and information services and the clinical critical care team and wider, nobody had to be asked to kind of put in the extra effort, and yeah, everyone kind of just went that extra mile and did it with a smile on our face, I think. Did we, Graham?
Yes, absolutely. Thanks very much, John. And it's been a real joy. I should also mention the Royal College of Physicians of Edinburgh, who are our partners in the MSc. So this is where we're at. We're 191 countries around the world, over 40,000 students enrolled, and we've had 8 million visits to various of the pieces. Interestingly, some of my colleagues weren't that positive about including the deteriorating patient out in the ward stuff. They're based in critical care. I'm a physician, so I've done acute medicine as well as critical care. We've had over half of our visits, so about 4 million visits to the self-care and staff wellbeing and the deteriorating patient pages. Somebody's been to the meditation part in that last one 61 times, so I'd encourage you to have a look at that. That was clearly helpful. Multiple users were using one device, so the numbers are not that accurate, and the feedback throughout has been absolutely clear that our needs analysis was right on the money. And we've had very positive, we've had almost 17,000 comments now along these lines, which are, thank you, it's been really helpful. And this was for frontline clinical staff to help them in a very uncertain and difficult time. What next? Our second run starts on Monday. We haven't changed a huge amount. There are some updates to make, but we've already started to discuss other MOOCs. Maternal critical care is something that is in our programme already, and that's something we're looking at for a UK-wide audience, perhaps. And John and I met with some individuals from the organ donation community yesterday about potential for a MOOC in that regard. So on behalf of our project team and all of the organisations and teams involved, I'd like to say thank you, and particularly thank you to them, and thank you to FutureLearn.
That was a really fascinating, I guess, insight into what can be done where there's a will. And, you know, I know on behalf of Christina and Beatrix, if you're talking about maternal critical care, it would be remiss of me to just check that you're not thinking about similar timelines this time. Good. That's a relief.
Yeah.
There is a bit of a view going around of like, oh, well, if you can do it this fast once, then yeah. I think there was a lot of things that were in place for us already, as you probably know. You know, I guess Graham's team.
60% of our videos and e-lectures and things had been created for the MSc, so they were already there. Although we did, as John said, create a lot of stuff in that last week.
Yeah. Yes, yeah, and of course it was a very strange time, wasn't it, with the situation that you face. I guess just one very specific question, and John, this is probably to you. I mean, how do you manage the updates from a practical perspective? How do you keep on top of what actually needs to be updated and manage that?
Well, I guess a lot of the kind of tech, the packages that we were seeing updated, I guess they would come via the critical care team, and we were using Articulate storyline packages, so they would be updated or refreshed or new ones created and then we would kind of plonk them in on our server and relink them. Yeah, it was quite and I guess those kind of narrative PowerPoints, in some ways they're fast to produce, whereas I think if we were doing kind of pieces to camera on location, that would take a lot longer. So yeah, but it was quite fast and furious. And then I guess the technical team would then kind of update within the course.
Can I just say one of the drivers for that speed was we were speaking to and hearing from our critical care colleagues in the north of Italy, who were a couple of weeks ahead of us in terms of the devastation that COVID was causing. And we recognised that we had a very small period of time as our health services were developing the response where people would have the time to access this kind of learning. John was very kind. That Friday, when it looked as if we may be a week away from launching rather than a couple of days away from launching, I had what you might describe as a slight rattle out the pram moment. The reason for that was to get it into the public domain so that the people who were going to be in a week, 10 days time, inundated with patients had a wee bit of an opportunity to look at the materials before that happened.
Mm. Yeah, certainly a really, really important course. And thank you. If we had more time for questions, there are certainly different areas that we'd like to explore. But unfortunately, on this occasion, we don't. But thank you very much for your talk. That was fascinating.
Thank you very much, Helen.
So I shall move on to our next speaker. Mohammed Razai is an academic clinical fellow in primary care at the Population Research Institute within St George's University of London. He initially trained at the University of Cambridge and is currently a practicing GP in London. Now, Mohammed is the lead educator on managing COVID-19 in primary care and an educator on the recently published COVID-19 in Africa, which again is in primary care settings. He also has been the lead author of 2 recent guides for primary care, one for UK GPs and one that looks at mitigating the psychological impact of COVID-19. So, Mohammed, the floor's yours.
Hello, thank you very much, Helen, for the introduction. I'll just get the slides up. Hello, and thank you again for joining us today. You've already heard an extraordinary and really fascinating insight from Mary, Graham, and John on the processes involved and the backstage processes for developing a MOOC that is at a speed over a very short period of time. So I'm not going to go through those insights because you've got an idea of what it takes to build such a MOOC over a very short space of time. But I'm going to, over the next few minutes, just talk about some of the learning points and the broad principles about our course and what it means moving on into the future. As Helen said, that we have developed 2 courses. One is for primary care doctors in the UK, and that was our first MOOC. And the second MOOC is for people, for primary care professionals in the African context. It was Eric Hoffer who said that in a world of change, the learners shall inherit the earth, while the learned shall find themselves perfectly suited for a world that no longer exists. I think during this period of uncertainty and change, we are all learners at various levels and trying to adapt quickly and make the best use of the opportunities we have as clinicians, scientists, educators, to support our communities. to support our students, our colleagues working in primary or secondary care, or any healthcare setting, patients and their carers. As Helen mentioned, we have the first course that we developed was around March. We developed within this kind of spirit of getting our fellow primary cares through this crisis, that we created this course, Managing COVID-19 in Primary Care. It was very narrowly focused, as opposed to what you heard from Mary in London School of Hygiene and Tropical Medicine, also from Graham and John, that their course was very broad, appealed to a lot of specialties. But our course was specifically for primary care, primarily aimed at primary care physicians and staff in the United Kingdom, which we later followed up with a course specifically designed for low and middle income countries across the African continent. Both of these courses are live and is still running. And this course in the African context also aimed at primary care physicians primarily, COVID-19 in Africa, managing the outbreak in primary care settings. Helen alluded to this and mentioned about the work we have been doing. I am a clinician and scientist by background, and our first response in the initial period of COVID-19 was publishing a couple of papers as guides for primary care community in the British Medical Journal on how to respond to this novel coronavirus, whilst bearing in mind the wider physical and mental health impacts of the pandemic. I would
Mohammed,
yes.
Mohammed, could I just interrupt you a second? Unfortunately, your screen isn't sharing, and so we're not able to see your slides.
Okay. So I'm not sure what has happened. I think I'm just going to close again and reshare.
That's it.
Stop
Looking.
sharing. Yeah, share again. See if I can share again. Can you see it now? I'm not sure if it works.
Yes, now we can see them.
Wonderful, thank you. So as Helen mentioned, our first response was to develop guidance that was published in the British Medical Journal. I'm going to play just about a minute of one of the introductions we did initially for one of the courses in March, and Dominic is just going to quickly play that, I think. Hello, I'm Dr. Mohammed Rezai from St George's University of London, and welcome to the course. In a few short weeks, a localized outbreak of a respiratory illness in a Chinese city became a pandemic that has affected almost every country, society, and aspect of modern life. We are heading towards an uncertain and challenging future which requires preparedness, knowledge, as well as commitment to sharing and learning from experts and each other. With a huge amount of information coming in every day with news and advice about COVID-19, it can be difficult to make sense of the information relevant for frontline clinical practice. For this course, we will take participants through the most useful and up-to-date research and guidance. By the end of the program, we are hopeful that participants will have received a concise, practical, and where possible, evidence-based approach to dealing with COVID-19 in primary care. Thank you very much, Dominic, for playing that. I just wanted to give an idea of what we were thinking about when we developed the course and what was the primary aim. I think Mary mentioned that in the initial period of the pandemic, there was a lot of concern about misinformation, and there was a lot of information coming through as well that was correct information, but for frontline clinicians, quite overwhelming. So our purpose was to build something practical, reliable, and concise. And the first course was developed over 2 weeks in March, just about 2 weeks. And both courses are run between 2 to 3 weeks to address the kind of confusion, mainly for primary care doctors, and information overload, and in some instances, misinformation. To base it on some kind of evidence and expert guidance for frontline staff, bearing in mind the challenges that this was an evolving outbreak and the guidance was changing almost every day around the world, in particular in the United Kingdom. In the initial period of the pandemic, now analysis shows that an average doctor would get about 50 emails a day containing various guides and protocols for managing COVID-19. And you can see the problem there, trying to look for the right information whilst you have an unwell patient in front of you. And in terms of the other aims that we had was to support primary care doctors and staff to mitigate the effects of uncertainty and change and the wider effects of COVID-19, especially the adverse effects on the mental and physical health of frontline staff. I'm just going to briefly talk about some of the numbers that you've already heard from Mary, Graham and John about the impact that we can measure some numbers in terms of what the course, how well it has been received. We were overwhelmed by the incredible responses of about 30,000 primary care colleagues, patients, carers. It wasn't just healthcare professionals, so members of the public from 190 countries and regions of the world over the last few months. So these are just in numbers. So the real impact is discussions and sharing and the collaboration, and ultimately, hopefully, better outcome for our patients and communities, which we hope these courses contributed towards. We've had thousands of feedback incorporated, the courses incorporated in several medical schools curricula, and also endorsed by Health Education England and NHS England. And it also featured in a number of news outlets. And the learners were very positive about the experience they had. They rated very highly on the FutureLearn platform. Again, the engagement from learners have been phenomenal. Thanks to FutureLearn team for facilitating such an innovative platform, learning forum. So many people can come learn together and share their best practices. The benefit of online learning is that you can use the feedback in real time from learners and more effectively, as opposed to the traditional ways of gathering feedback. Online feedback is instant, and you can modify as you move, as you go along. And some of the learning points for co-creating these courses over the last few months have been: the first one is, as we have heard throughout these presentations, is the need to move really fast, to provide support to our colleagues and counter misinformation, rumors, and sometimes, unfortunately, fake news. And considering the needs of, that's something that was very important to me, was considering the needs of low and middle income countries. It's very well to design a course for high income countries where there are so many facilities, not just in terms of access to medical, educational facilities and high tech, but also access to healthcare facilities in terms of the sort of things we were talking about. It was really important to consider the needs of those countries, because a large number of people who participated in the course and actively engaged and provided very in-depth and useful feedback throughout these courses have been from South Asia, Africa, and South America. Engaging with learners and changing gears as needed, as I said earlier, and collaborating with other educators and using the local expertise. It is important not to reinvent the wheel every time, and using the existing facilities and resources that are already available. It is also important to have a good team so you can provide the kind of the timelines you can stick by and just deliver the course within a very short space of time. Developing sometimes things from scratch would take a lot of commitment and a lot of effort from various people in the team. So I think it is really important to form that team. And some broad reflections about what moving forward the innovation in higher education and education in general and learning would mean is that, as we heard right at the beginning, reflections from other educators, the blended online learning will be tried, tested, and very much used on a wider scale after the pandemic. I think the crisis will help us to come together across various boundaries and learn from each other and their expertise about remote education. We will be learning together in a rapidly changing educational landscape, so the educators learning as much as those who are participating in the course, and we are learning together. I think that's all I had to. I think the slides hopefully presented. Thank you very much indeed.
Thank you, Mohammed. Now, I've got one question for you, which I hope doesn't put you too much on the spot. You mentioned at the end, everybody learning from everybody else. And I just wonder, you know, because this is the first time you've been involved with the FutureLearn course and this style of learning, is there anything that really jumped out at you, either that you expected or that was unexpected from your course? Anything that you learned around delivering information in this way, or just from the learners themselves?
Yeah, so the first thing that it was quite unexpected, because our course was quite, we had a very narrow audience in mind, just primary care staff in the UK. So we were not expecting to have as many participants in the course. So that was a surprise. And also the level of engagement was very, very high. And people were writing very in-depth, reflective learning, almost a mini essay on the platform when discussing, and also responding to other learners. So that was something that I found really valuable, not just in terms of feedback for our material, but also learning from others and where they were and where there were differences in terms of approaches, public health approaches to managing COVID-19. So I think that forum was incredibly helpful for us. And I, in many ways, I was quite surprised by the level of engagement.
That's really good to hear. And do you have a sense of whether your learner group was maybe 95% professional learners with perhaps just a smattering of general public? Was there a strong patient voice in there as well?
I think that was another thing that I was quite surprised. There are about, I would say there were much more than about 10-20%, probably about 30, 35, 40% of people who were on the platform were either patients or carers or people, other professional groups that were not in healthcare or not in primary care. So there was a strong patient voice, and also those who were looking after patients. Some really incredible stories, anonymized stories of patients that people shared on the platform about in various parts of the world. And it was incredibly good to hear about those stories.
Well, it was certainly a fascinating course and has made a massive difference. So, Mohammed, thank you very much.
Thank you.
So our final speaker is Karishma Saran from the Foundation for Innovative Diagnostics, or FIND. Now, FIND developed a course called COVID-19 Diagnostics and Testing. The fascinating thing for us with Karishma and her organisation was that FIND found FutureLearn when they needed a platform with global reach to develop a course. And from our perspective, we were incredibly impressed at the way that FIND developed a really high quality course very rapidly with no experience of working in this way. So Karishma is a strategic communications officer at FIND and also fulfills the role of secretariat for Stop TB's new diagnostic working group hosted at FIND. She has a keen interest in public health strategy, advocacy, communications and policy research. We really look forward to hearing from you, Karishma.
Hi everyone, and thank you, Helen, for the introduction, and also thank you for giving FIND the opportunity to share our FutureLearn journey with all of you. So for those who don't know, FIND, or the Foundation for Innovative New Diagnostics, is a global non-profit organization that is essentially working to drive innovation in the development of diagnostics, development and delivery of diagnostics for diseases that affect the poorest populations in the world. So FIND works across multiple program areas, of which pandemic preparedness has always been one. So even before the pandemic, even before WHO called this a pandemic, we were already working in this area, preparing for situations such as this one. So while it feels like our entire organization is working on COVID at the moment, we're also being very conscious not to neglect other diseases that we also work on, such as tuberculosis and malaria, to ensure that no disease in the world should get sidetracked because of a pandemic. Interestingly enough, my own FutureLearn journey began over Christmas break when I was home in Mumbai, and I did a MOOC on FutureLearn, which was on antimicrobial resistance. So as a learner, I really enjoyed using the platform, and I was recommending it to friends and not realizing that soon after I would actually be at the back end of this platform working with the FutureLearn team, trying to get this COVID-19 diagnostics training out in record time. So before I really jump into our FutureLearn story, I just wanted to share why diagnostics is so important in addressing this pandemic. So mass testing is really our first line of defense at the moment. Testing saves lives. It allows economies to reopen and stay open. Testing is going to be vital in the future to introduce vaccines and therapeutics. Currently, testing is the only tool that we have in hand for COVID-19. And testing at the moment depends on well-resourced labs as well as complex diagnostics, which are fraught with high prices and broken supply chains. So we're really trying to change that, and we're hoping that a simple and easy-to-use, reliable and affordable rapid diagnostic test for COVID-19 can be made available in the near future, which sort of seems unreal at the moment, but we're really hoping for that. So just looking back and coming back to our FutureLearn experience, it was on the 16th of March that was declared the first day of officially working from home. And, roughly 10 days later, on 25th of March, I learned that FIND was interested in developing an online training on COVID-19 diagnostics. And I think this was around the time that we got in touch with FutureLearn. And on the 20th of April, less than a month later, we launched our first MOOC on COVID-19 diagnostics and testing with our partners, the London School of Hygiene and Tropical Medicine, who are also here with us today and who developed the very first COVID MOOC on the FutureLearn platform, and also with the African Society for Lab Medicine, that is ASLM. So to be very honest, those 3.5 weeks are a complete blur, like some of my colleagues have mentioned during this panel, that everything just happened so quickly. And I can safely say that none of those cakes being baked that you saw on Instagram and none of the movie recommendations were given by the MOOC team. So yeah, it was truly insane, but we're really, really happy with the result. And just to tell you why timing was of the essence. Timing was of the essence for a number of reasons. So countries were really focused on scaling up testing very rapidly. So regulatory approvals were being, sped up, and countries were accelerating, purchasing, scaling up, building labs. But there was not enough information out there on how to perform a test. What are the infection control measures? What are the local, national guidelines? What are WHO's guidelines? How should you protect the health worker? We really felt a gap in that kind of information, and we do work with a number of labs around the world. So this is the information that we were hearing about. And so we tried to plug in these gaps essentially by developing this MOOC. And we consulted our local offices, around the world. We worked with our partners, the technical experts, as well as the WHO to vet some of the information. And so we packaged this information in such a way on the FutureLearn platform so that if you're a first-time learner, you can basically get everything you need to set up a COVID-19 lab and to perform the test. And if you're sort of trying to upskill and return to practice, you can really take what you want from the course. So I'm just going to share one slide with you very quickly, which is about the impact of our MOOC. Are you able to see my screen?
We're not, Karishma, no.
Are you able to see it now?
Yeah, that's great.
Okay, great. So like I said, I have just one slide, and I just wanted to quickly show you the impact of our course on COVID-19 diagnostics and testing, which launched on the 20th of April. And we've also launched the second run of this course on the 15th of June. So just coming to the first run, we had a huge number of enrollments. Of these enrollments, you can see that most of the learners were actually new learners. So these are people who we brought to the FutureLearn platform essentially for the first time. We had learners from 186 countries, and we had, as you can see, the age range is between about 26 to 45. That's where we had the maximum learners in terms of age group. And in terms of employment, most of the learners were professional learners. We had a 4.8 star rating, so we're very pleased with that. And you can see some of the learner testimonies below, which show that learners were really satisfied with this course. And I'd like to say that we are also very satisfied with our FutureLearn experience. We had a brilliant time working with you, Helen, as well as your team, with Molly, with Christina, with Nicole. It really felt as though we were one unit working on this jointly, and that was a really wonderful experience. So just to slowly wrap up, so we launched one course, and now we have 3 more MOOCs in the pipeline. So as you mentioned, Helen, this was the first time for us. We are public health experts, we're not education experts, but our work with FutureLearn has really enabled us and encouraged us to, share information in this format. And I think the beauty of the FutureLearn platform is that you can really interact with your learners in real time, and learners not only interact with mentors, but they also get to interact with each other and learn from each other. So, just again, wrapping up, I think at a time like this, everyone working in public health is a frontline worker. And everybody working in public health is also having to double up as a communications professional and share the right information, accurate information, and put an end to misinformation. So I think my final thought is just that, we have so many virtual platforms available. We're working in a virtual world. We have to make the best use of these platforms while not forgetting to make these very platforms available to all. Thank you, Helen. That's all from me.
Thank you, Karishma. And thank you for your kind words as well about FutureLearn. I mean, I can definitely endorse it was an amazing 4.8. Don't know where the 0.2 is because it should have been a 5 course, but no, given that you are new to the platform, it was amazing the speed that you got out a really fantastic course. So you mentioned about future courses. Just one question, I guess. You know, looking forward to developing courses without maybe the urgency that you had the first time around, what would be the one thing that you would do this time maybe differently when you've got a little more time to plan and to think?
So, you know, when we were preparing for the first MOOC, obviously we were just going insane, and it was a very collaborative process. We reached out to many technical experts, but I think going forward, since FIND as an organization has such a wide network, I would like to reach out to technical experts across the world, across FIND's offices, spend more time consulting with the WHO that has also made a lot more information available right now. So when we were launching the first course, there was a lot of information out there, but you know, things are moving so rapidly in the COVID space that now there's a lot more out there, and researchers and scientists at the time, we were all dealing with something that was completely unknown. But now we do have more information, so I'd like to spend more time actually studying that information and crowdsourcing it and vetting it with our technical experts and then putting it out there for the learners.
So making the most of the networks that you have globally.
Absolutely.
Yeah. Well, we look forward to those courses in the future, Karishma, and thank you.
Thank you.
So is it possible just to have all our panelists on the screen, Dominic? Could we, there's just one, I know we're slightly tight for time, but it would just be really nice to leave with a comment from all our panelists. Now, I think all of you have had an experience over the last couple of months. You know, you've seen a situation that needed responding to, and you responded to it incredibly rapidly, and have developed some fantastic courses. Now, this doesn't have to be positive, it could be negative as well, but what would be the one thing that you'll take away from your COVID experience with FutureLearn, when you sit back with your cup of cocoa at night and just think, wow, that was quite something? What's the one thing? Could we start, Mary, with you?
Gosh, one thing. As a researcher, it's very difficult to kind of condense it all to one thing, but I will do my best. I think just off the top of my head, it would just be something that's been touched on, I think, in each of the presentations, which is that thing of being able to have conversations with such a broad range of people, and that the depth to which those conversations can be had on an online platform. I think that's something that I will definitely take away, because prior to this, I probably didn't really appreciate how much engagement and the depth to which people would engage and shape the way in which we talk about certain topics. So.
Thank you, and I'm sorry to put you on the spot first. That was perhaps a little unfair. Yes, so maybe Graham, could I come to you next?
Yes, Helen, thank you. I think the first words that come into my mind are teamworking and generosity and shared common humanity. There was a need. A lot of people have come together in terms of our learning process, and that includes industry partners. I meant to mention Elsevier and McGraw-Hill, who've provided textbooks free of charge for our learners. But it's teamworking and sharing and helping each other.
Thank you. And it was certainly necessary, wasn't it, to all pulled together very rapidly in your neck of the woods whilst you were developing your content. So maybe John Jack, can we go to you, John?
Sure. Yep. I guess it kind of echoing Graham's thought. I guess willingness and I think kind of care. I guess with FutureLearn, I've always really appreciated the kind of care that you as a company put into our courses. You know, like your QAs and the level of detail that you look at narrative structure and So I guess the kind of care that you put into our courses and I guess even through our work when it was hectic as a group, we were still asking each other to look after each other as well and practice a bit of self-care. Yeah.
Yeah, it's really important. And how about you, Mohammed?
Yes, I just wanted to echo what everyone else has said, but to add that learning has changed forever. I think after COVID-19, we will have a different idea of what it means to learn because FutureLearn and many other platforms online are not just something that we will have as an additional learning. These will be the main media of learning in future because these are the best and most effective ways to deliver information in a very short space of time. 190 countries and so many other places, it's just extraordinary. You won't be able to reach that in the traditional ways of learning.
No, and we're not going to be going back to face anytime soon, one wouldn't have thought. And so, Karishma?
Yes, I think from my side, what I found really interesting is that the learning is a two-way process. So, the mentors are sharing information, but we also had a lot to learn from our learners. So just to give you an example, maybe someone from a low and middle income country shared a comment about how her lab did not have a particular kind of equipment, or there was some kind of challenge which was not allowing them to do the testing. So I feel that sometimes, policymakers and ministries may try to paint a pretty picture about what's happening on the ground, but these are real people who are able to tell you a true story of what's happening out there, which also enables us to respond accurately. So I think that's one of the benefits of this program.
That's an incredibly important point. Yes, definitely. And it speaks really to Mary, what you were saying about the social learning at the beginning as well. So, well, it just remains for me to thank you all for joining us this morning at the Festival of Learning. It's been a complete delight to chair the session. And certainly what we take away from the experience that we've had with all of you is a completely new lens on which to see what learning could look like and what can be achieved where there's a real joint will. So thank you all very much and have a good rest of the day.
Helen.
Thank you.
Thanks, everyone.
Helen. Thank you all.
Imagine a world where the highest quality learning is open to all, regardless of status, location, or circumstances. That's what we're building. We're FutureLearn. Our purpose is to transform access to education. We're jointly owned by the Open University and the Seek Group, world leaders in distance education and employment businesses. We've reached over 10 million learners to date. We're a multi-award winning team with the skills, passion, and plan to deliver the best online learning experience. We offer a huge selection of courses from over 175 leading universities and organisational partners all over the world. We make learning simple, one step at a time on mobile, tablet, and desktop, so you can fit your learning around your life. And we underpin it all with social learning. What's social learning? Put simply, it's harnessing the power of the community. We learn best when we share and debate ideas with fellow learners, understanding different experiences and perspectives, filling the gaps in our own knowledge. It adds an entirely new dimension and creates a richer learning experience. We make all this happen with flexible short courses, programs, micro-credentials, and degrees. Each course is created by a leading university or organisation and made up of bite-sized lessons. You can usually start learning for free. Short course upgrades offer access to all course materials and the chance to earn a certificate. Our unlimited offer allows you to pay once a year to upgrade on as many courses as you like. Paid courses offer a more focused, professionally orientated learning community. Sponsored courses help organisations widen participation in higher education or meet responsibility goals. Our programmes enable you to learn in depth with groups of courses that help you explore different aspects of a topic. Our micro-credentials allow you to upskill or reskill with short stackable courses that award academic credit or recognition of prior learning. We offer a growing range of accredited undergraduate and postgraduate degrees. Degrees are arranged as sets of courses which you can take flexibly, depending on how much time you want to commit each term. We also support our academic partners, public bodies, and various organisations with a range of extra services. These include course creation, quick authoring for faster course development and improved learning design, plus end-to-end support from your own dedicated team. Course analytics to better understand your learner demographics and what they think of your courses. Learner management. Guide cohorts with powerful course facilitation tools. Track and support individual learners. Income generation. A revenue share of paid courses and upgrades, as well as tools to attract learners to further study with your organisation. Employers can also use FutureLearn in the workplace to upskill or reskill employees. FutureLearn, transforming access to education.